it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is on the topic of the art of a medical interview. Now, a medical interview is just a fancy word for the doctor's visit. So, a medical interview is a normal doctor's visit. Now, in this video, I'll be talking about two main parts. Firstly, I'll be talking about how to extract the right information, and then I'll be talking about open-ended versus closed-ended questions. Along the way, I'll also be adding some little parts like what to ask in an interview, in a medical interview, and also the difference between the questioning pyramid and the funnel techniques, etc. So let's get started on my first main part, which is on how to extract the right information. Now, when you visit the doctor's office, you are sitting in a room where you are waiting for the doctor, and so when the doctor comes in, they will ask you a few questions, right? Well, firstly, there are two main techniques for questioning the patients. There is the questioning pyramid and also the funnel technique. So what is the questioning pyramid? Well, the questioning pyramid, think of a pyramid. A pyramid is a shape like this. Now, the questioning pyramid basically is, firstly, we will ask open-ended questions. So we will ask open-ended questions first. So open-ended. So these are the broad questions. So for example, questions like, tell me what brought you in today, and also what pain are you feeling? Those are the open-ended questions. Then as we move up the ladder, we have the focus questions. So the focus questions are the non-leading questions, but they are not exactly closed. The close is for the top one. So the close-ended questions. That is the close-ended question. So that is the questioning pyramid. So firstly, the open-ended questions, I will ask the patient start with, for example, things like, tell me what brought you in today, describe to me how you're feeling. So overall, it's like I allow the patient to speak and give me the overall details on their well-being. Next, on the focus part, the focused questions or non-leading questions is when once the story has shared, I will need to use specific but non-biased questions to fill the gaps. So instead of, you're not having chest pain, are you? I need to ask them leading questions. For example, what does the pain feel like? It's not exactly close, but it's non-leading. So it's not close and it's not also open-ended. And finally, for the close-ended questions, these are the questions that I will need to use at the end of the interview or the doctor's visit. So the close-ended questions are questions used to confirm very specific points. So it's either yes or no questions or multiple choice questions. So the patient will only answer like a few words, not describing it too much. So those are the close-ended, focused, and focused questions. Now, what is the difference between the questioning pyramid and the funnel technique? Well, the funnel technique is the exact opposite of the questioning pyramid. So the questioning pyramid, first we have open-ended, then focused, then closed. And the opposite of that is we start with closed, focus, and then we end with open-ended. So the questioning pyramid, think of it like starts with narrow and end with broad, and then the funnel technique, or as you think of a funnel, it goes down like this, like a cone, but an upside down cone. It starts with broad and it ends with narrow. So it ends with narrow. So yeah, those are the things that we need to talk about on the first part, on the questioning pyramid. So the questioning pyramid is starting with broad, open-ended, and closing with narrow. So I will need to fix that. And the funnel technique starts with narrow and ends with broad, so I will need to fix that as well. That is for the questioning pyramid. Next, how to extract the right information. The next technique is using mnemonics. So mnemonics, for example, Socrates. So Socrates, this will include site, onset, character, radiation, associated symptoms, timing, exacerbating or relieving or alleviating techniques, factors, and severity. So that is an example of the mnemonic that we usually use when interviewing the patient. And finally, active listening and reflection. So I might be telling the patient, tell me more, or go on. I will need to use those words to be able to gather as much information as possible. So some techniques I will need to use are paraphrasing the patient, for example, reciting what they have said, and also summarizing the key main points, and then paraphrasing the patient and make sure that we are correct. So those are the things, some of the techniques to extract the right information. Moving on, what questions to ask in an interview? Well, in a medical interview, we could ask questions. We need to ask questions on the topic of past medical history, allergies, or current medications that they are on, or their social history, their lifestyle habits, their overall habits, the review of systems, so reviewing their systems, the chief complaints, the main reason they are going to the doctor and to visit and check up, that is the chief complaint, and also the history of patient illness. So those are the things that we will need to ask in a medical interview. The difference between open-ended versus closed-ended questions. So this is the final part. Open-ended versus closed-ended. So it is exactly what it sounds like. Closed-ended questions are questions that is basically like yes or no questions or multiple choice questions. So closed-ended questions are restrictive, but they can confirm specific points. So they can confirm specific data. So for example, when I will need to use them is at the end of an interview, for example, at the end, and I will need to check for vital signs. And yeah, that is when I will need to check for specific signs and check again if I'm correct. So that is the close-ended questions. So for example, I might be asking my patient, is the pain on the left or the right side? Or I could be asking them, have you had a fever since yesterday? Or has your temperature significantly increased last evening? Things like that. So that is an example of a closed-ended question. Moving on, the open-ended questions. In contrast, the open-ended questions is the questions that we will need to get the most details from. So, for example, what brings you in today? Or tell me more about this pain. How has this affected your life so far? So some questions like that. So these questions let the patient lead, and it will help us to gain more details into what the patient is experiencing. So those are the differences between the closed-ended and the open-ended questions. And this is related to the questioning pyramid and the funnel technique, which I will later talk about in my D2. So those are all the things that I have to say for my main video on the art of a medical interview. I hope that you learned something new from this video, or if you have any other feedback or comment on my works, please share it with me. I'll be glad to hear it all. Thank you again for listening to my video, and I hope to see you soon. Goodbye!